I'd like to welcome Dr. Shprecher to their program here today. Dr. Shprecher is a board-certified movement disorder neurologist based in Arizona. He serves as clinical associate professor of neurology at the University of Arizona College of Medicine in Phoenix and is affiliated with Banner Health. Dr. Shprecher specializes in Tourette Syndrome and other tic disorders, as well as Parkinson's disease, dystonia, and Huntington's disease. Known for his compassionate, patient-centered approach, he is deeply committed to improving quality of life for individuals living with movement disorders. In addition to his clinical work, Dr. Shprecher is involved in medical education and research, contributing to advancements in the understanding and treatment of complex neurological conditions. I'd like to welcome Dr. Shprecher to the program here today. We're very thankful to have him, and we're looking forward to hearing from you. The first question I'd like to start with is, what initially drew you to specializing in Tourette syndrome and movement disorders?
Yeah, well, first of all, really appreciate your interest in the topic and appreciate the ability to contribute. I had a little bit of a different route. I know a lot of people have kind of a personal connection to the conditions that they specialize in. For me, growing up, I myself had tics that weren't formally diagnosed as such. And certainly those aren't the only problems I had growing up. But when I ultimately got interested in neurology and did one of my research projects as a neurologist in training, I kind of figured out that I had Tourette syndrome. So that certainly kind of gave me personal motivation to subspecialize in movement disorders and to really be involved earlier in the process and the journey for people figuring out what they have.
So another question for you would be, what would be some of the most common misconceptions about Tourette syndrome that you encounter in your practice?
I know other people probably said this concept that people with Tourette's curse a lot is a misconception. I haven't run into that as much as we used to kind of back in the 20th century or when I was first starting out. But I think one area of confusion that I see, not just with people I'm seeing as a patient, but also with doctors, is this difficulty understanding the difference between other involuntary movements and tics and Tourette's. And it's a complicated question, but many people have something called functional tic-like behaviors. And even people with Tourette's can also, in addition to that, have these functional tic-like behaviors. And I think people sometimes have trouble understanding the differences between the two. And that's a real common challenge in what we do as movement disorder neurologists.
Okay. And how does Tourette's affect individuals differently across childhood, adolescence, and adulthood?
So I think a really important challenge for kids is when somebody stands out, there can often be either bullying or even teachers or parents may misunderstand it and take it the wrong way as misbehaving. Many people improve as they get older, but for those who don't or whose tics kind of worsen as adults, these are people who seem to often have increases when they're under stress or if their anxiety or other what we call the psychiatric conditions are acting up or not well controlled. And in those cases, it can also cause misunderstandings in public or in the workplace, but also lead to kind of inappropriate either singling out or even reprimands in the workplace if it's not properly explained to the employers or the coworkers.
Okay. I think that sort of leads into the next question was, how important is early diagnosis and support in improving long-term outcomes?
So it's a very challenging question to answer with research because we haven't yet gotten that 30-year study done where we can compare people who get early treatment and diagnosis from people who don't. But there's some limited evidence that if we can teach people the strategies, not just the behavioral therapies for tics, but also how to manage those psychiatric conditions that come along with, and in particular, how to manage stress and the impact of stress and worsening the tics, then people can have the tools to better manage, even explain their tics as they grow up and as they get out into the workforce and then become parents and build relationships.
Okay. And what advice would you give to those parents who are feeling overwhelmed after a newly diagnosed son or daughter with Tourette syndrome?
So I'd say the most important advice is that for almost everyone with tics and Tourette's, even if they don't have dramatic improvement as they grow up, and for a majority of kids they do, they still, with the proper diagnosis, support, and a lot of that being non-medical kind of behavioral interventions and education, can still lead very successful and meaningful lives. So it's something that absolutely can be managed.
That's very promising. What developments in research and with regards to Tourette syndrome give you the most hope right now?
I think what gives me the most hope is that we have some really different types of treatments that are in clinical trials now. And it was a long time since we had other medicines besides just kind of the straight up antipsychotic medicines approved for Tourette's. We have one that's a unique type of medicine that may not have the same side effects of the older antipsychotics that may be under review, at least in the United States, with the Food and Drug Administration. There are other types of medicines that work in unique ways in the brain that are in clinical trials right now. So it's really encouraging that we have medicines in development that are better tolerated. And I think equally important is that we've learned that behavioral therapies work. And we're also looking at not just the behavioral therapy for tics, but mindfulness is another important emerging approach. And now that we've got that research showing it's promising, we're starting to get these therapies to where they're more widely available, not just in the United States, but throughout the world.
It's very nice to hear that there is some hope on the way. I know for some of the individuals who have had trouble, I know my son had a lot of issues, and there wasn't anything to really help him. So I think it's really promising for individuals in that situation to hear that there is some, light on the horizon for them. One last question before we go is, if there's one message you'd like families and individuals with Tourette syndrome to hear, what would it be?
So the key message for people with Tourette's and their families is that with a kind of team approach, communicating with the neurologist, the primary care, if there's a psychologist or psychiatrist involved, communicating with all the members of the team, and then for an individual, understanding what lifestyle measures are important to them to be able to feel the right amount of control over their life and not be overwhelmed and exhausted, to be able to manage stress appropriately. Most people can get adequate control of their symptoms and be able to manage healthy, successful lives, meaningful lives, despite having Tourette syndrome. But it's a very, very individualized approach that often needs to involve more than one specialist, and making sure that they're all communicating and sharing the records with one another.
Excellent. Thank you very much for your time, Dr. Shprecher, and we wish you all the best, and thank you for supporting our foundation, and thank you very much.
Yeah, thanks again for your interest, and please give my regards to Dr. Ganos.
Will do.